Title: What are the symptoms of PCOS and PCOD, and what is the recommended diet? We will talk about the signs, origins, prognosis, and available therapies in this video today. We might start by examining the PCOS symptoms. First, I want to make it clear that Polycystic Ovarian Syndrome, PCOS, and Polycystic Ovarian Disease, PCOD, are two designations for the same condition. It is referred to as a syndrome because it includes numerous symptoms. Similar to irregular periods, which arrive late or are insufficient, any woman who has less than 8 periods annually is deemed to have PCOD. There is a potential that some women will experience heavy periods because if it happens after a lengthy interval, a heavy period will arise as a result of the shedding of a thick uterine lining. Other than this, there will be obesity, which is difficult to treat and is typically present around the waist. The next symptom is uncontrollable hair growth, which will show up on your chest, back, or thighs in addition to hair loss on the scalp or temple region. It's possible for some people to have oily skin, which will result in breakouts or acne on their face or body. The difficulty in getting pregnant is a further significant symptom. Periods will come later as a result of the irregular egg production that occurs in PCOS owing to hormonal disturbances. And conception is also challenging. Let's now discuss the origins of PCOS. The first is a hormonal imbalance. Although the ovaries produce both male and female hormones, this disease causes higher levels of testosterone, as well as higher levels of prolactin, luteinizing hormone, and sex hormone-binding globulin, which all affect normal ovarian function. The second is a hereditary issue. Insulin resistance is the third. Insulin is a hormone that breaks down glucose in our bodies. Since you need to secrete more insulin to digest the same amount of sugar when you have PCOS, your insulin level rises as a result, which causes you to gain weight. How can PCOS be diagnosed? You should see a doctor if you experience any PCOS symptoms. Your doctor will inquire about your medical history as well as your symptoms, including your period, skin changes, hair loss, weight gain, and family history. Then we will give you instructions for a series of blood tests that you must complete on an empty stomach or on the second day of your period. These tests include those for follicle-stimulating hormone, FSH, luteinizing hormone, LH, lipid profiles, glucose tolerance tests to assess insulin resistance, thyroid and prolactin levels, and free testosterone, which will also be checked if you have acne or hair loss. We will also scan your ovaries to see if they have any little cysts, or polycystic ovaries, which will aid in the diagnosis. What PCOS treatments are available? It is treated in two ways. A change in lifestyle is the first and medication is the second. We are attempting to help you make more lifestyle adjustments so that you will require less medication. Weight loss is the first of these. If you are overweight, losing weight will improve your hormone and insulin levels. Egg production will occur naturally, and if you're trying to get pregnant, that will also be advantageous. The second is maintaining a healthy diet. What should people with PCOS avoid eating? Typically, I tell my patients to stay away from sugary foods and beverages like soda, chicory, honey, and even sweet fruits like sapodilla and mango. In addition, you should steer clear of anything made with white flour, such as biscuits, pizza, and hamburgers, among other things. And you ought to consume starch-rich meals like rice, potatoes, etc. in moderation. And you ought to minimize your consumption of tea and coffee. So what should someone with PCOS eat? For PCOS, you can consume meals high in protein, such as chickpeas, beans, black-eyed peas, eggs, and meats. In addition, you can consume green leafy vegetables, almonds, and oils, such as canola and rice bran. Ask us in the comments if you have any questions concerning diet and PCOS. Exercise is the third. Exercise in PCOT will lessen insulin resistance and enhance the quality of your insulin. You can work out in any way proper sleeping, which includes getting at least 8 hours of sleep each night, eating meals on time, and reducing stress is also crucial for PCOS therapy. What medications are used for PCOS? The treatment you receive for PCOS will depend on your symptoms. If you want to get pregnant, your doctor will prescribe letrozole or clomiphene, which aids in the development of eggs and kicks in on the second or third day of periods. It will promote egg development, lower estrogen levels, and raise FSH levels, making it easier for you to get pregnant. If you still have questions concerning PCOS, feel free to ask them in the comments area. If you enjoyed this video, be sure to like, and subscribe to our channel.